Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
What can you get if you're pregnant? So there really isn't much, but we've figured out some things that can help. And one thing is that you may want to skip numbing cream of any kind. Again, we're not certain that it really crosses the placental barrier, but why take chances?
Yes, and you have to be cautious, especially with what kind of numbing cream we're doing. So we know that lidocaine is safe in pregnancy. So that's one. Most of our really strong numbing medications are lidocaine, maybe mixed with tetracaine or some other ones that potentially could. So we try to avoid those. And so what I will do is if we're doing something very mild, like a skin pen, a microneedling treatment, something like that, you could do topical lidocaine base cream. That's not going to be as robust or as numbing as some of the other topicals that we usually like to do for our patients for comfort, but that can allow you to get a skin pen treatment. I did that for myself once during my pregnancy, and then you can do some really light chemical peels too.
Mm. So for those out there, what's a skin pen? It's a microneedling pen. It's a microneedling device. Essentially, this device just pokes tiny holes in your skin, not very deep, causes some bleeding, and helps with skin exfoliation, helps your skin look better, feel better, increases collagen growth. I would say definitely very, very safe in terms of pregnancy or not.
Yes.
Yeah.
And what about, Dr. Kim, what about lasers? What do you tell patients that call that want to do laser treatment during pregnancy? I
have, fortunately or unfortunately, gotten very rare phone calls about that. I think technically it's possible. It's just that lasers hurt more than a superficial skin pen. And so if patients, whether they're pregnant or not, they're having a hard time tolerating it, even with existing numbing cream or very strong numbing cream, occasionally sedation, I am not certain if they're going to tolerate it with little to no numbing cream at all and no sedation. I don't know what your experience has been.
I agree. I think that's it's another example of something that, do I think doing laser resurfacing on your face while you're pregnant, am I concerned about, that impacting the baby high level? I think that sounds very far-fetched. Again, they've not done studies on it. It falls into one of those things that would probably be okay, but there's no proof behind it. And, probably just wait until you're not pregnant anymore, just so that you can have a comfortable experience.
Absolutely.
So that's what I tell my patients.
One thing we think you could probably get safely is PRP, platelet-rich plasma.
Yes. And so that it's increasingly popular. So patients and people are starting to know more about it, but that is a naturally occurring product that we get from your own blood. So we do a blood draw in the office, take the vial out, and then we spin it down in a centrifuge and isolate the fraction of the blood that is packed with growth factors. And so that is a naturally occurring substance produced by your own body. So it stands to reason you can inject something that came from you back into yourself, whether it's injections into the hair to support hair growth, or injections into the face for cell regeneration and rejuvenation. That's a really beautiful, natural way to still take care of yourself, maybe treat yourself while you're pregnant. And things also to avoid deep chemical peels, things like that. Those are all chemicals that we would not recommend, and actually potentially could be harmful in pregnancy.
Yes. And as always, for the listeners out there, we're not your doctor. You should definitely talk to your doctor about what's safe or not safe, or maybe what's best for you.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.